Yo, yo, it's your boy Q. Thank you guys for joining me for another episode of the Corona Cast. Today's cast is probably going to be a short cast. I've been busting a lot of overtime at the workplace, so a little bit on the tired side today, but I just wanted to be consistent and get out here and stream for you guys and let you know what's going on, you know. So, first things first, let's get these numbers out here. So, as of today, the total number of confirmed cases of COVID 19 worldwide is at 1.4 million. The death toll is 83,000, over 83,000 deaths worldwide. And recoveries worldwide is 308,000 recoveries thus far. In the US, the confirmed number of cases of COVID 19 are 398,199, with the death toll reaching 12,862. 12,862. And the number of recoveries reported at 18,969. In New York, the confirmed cases are 81,803 as of this recording. And the number of deaths are 4,965. Now, in the state that I live in, Georgia, we have 9,892 confirmed cases, and the death toll is up to 362. So that's where we are, people. I'm hearing that we are, in some states, like New York, they feel like they're starting to slow down, but they had record highs in the death toll between New York, New Jersey, and Connecticut yesterday. I believe in New York alone, it was 1,800 deaths. That's just in one day. So is it getting worse? Is it improving? It's hard to tell. But today's episode, like I said, it's going to probably be a short stream, but I titled this one Too Close for Comfort. As I told you guys, I recently returned back to work, and I work in a retail environment. And I've actually been back for like 5 actual days that I've actually been back. I worked Thursday and Friday of last week, then Monday, Tuesday, and Wednesday of this week. And I found out today that someone I work with has this. It's confirmed. We don't know the identity of the person. That information is private. But without having that information, how do you know if you've been exposed? So my question is, what should you do when you find out one of your coworkers has been confirmed to have coronavirus? How are you supposed to handle something like that? You're concerned for the person, that person's health and well-being. And at the same time, you start being concerned for yourself. You start wondering, was I around that individual? And on top of it, this individual, from the information we were given, is asymptomatic, meaning not showing any symptoms. I'm not sure how this individual was able to get a test that confirmed that, he or she has this, but they must have been in contact with someone who was showing symptoms. And after getting this news, I called up my healthcare provider and I gave them the information and I'm like, can I get a test? But I'm not showing any symptoms. I don't have a fever of over 104 consistently. I don't have, I have seasonal allergies, so I cough here and there, but I don't have a cough, a consistent cough like that. And I'm not experiencing shortness of breath, which that's a blessing, thank God. But at the same time, with this virus spreading asymptomatically, that doesn't mean anything. So if you are suspected to be exposed to somebody who had it, who's asymptomatic, and you're asymptomatic and you can't be tested, how can you protect the public? So, which makes me pose this question: how should you react when a person's identity must remain secret to protect their privacy, but at the same time, while protecting their privacy, we're putting other people's health at risk? So, there's kind of a contradiction there, where we have to figure that out. Where do we draw the line between privacy and public safety? Where's the line drawn? You know, um, and I know that it's hard to get these tests in these different cities and states and what have you. I know it's tough. It's difficult to get enough test kits, but something has to be done because a lot of us could be walking out here infected and spreading this virus unknowingly to other people. You know, especially, you don't want to bring things back into your home around your children, around your significant other. You don't want to do that. Or if you live with elderly parents or whoever, and it's scary, and the criteria is you have to be showing these particular symptoms in order to basically qualify to get a test. And so after calling my healthcare provider, I called, it's like a public health type place that works with my company. And I got some advice from them, and they told me stay home for the next 2 weeks because I don't know if I was directly exposed with this individual because I don't know the identity of the individual. So I had to call my manager and inform my manager that I was advised to stay home for 2 weeks. And, with my wife as well, she's scared and paranoid and freaking out. And she just like, yo, stay home. I need you to stay home, and for her peace of mind and for the protection and safety of my family, I have to oblige. So, what do you do in these times? You know, we have to make tough choices right now. We have to decide between making money and protecting those we care about, which a lot of times making money and taking care of those you love go hand in hand. That's part of it. But in this situation, it's like you have to draw that line. And I'm blessed to have some vacation time available to me that I can put in to cover me for the lost wages. But I know everyone doesn't have that. So there are people out there that basically just out there. No income, no job, or laid off, or can't go back to work, or whatever the case may be. So my prayers and my thoughts go out to you out there who may be in that situation. These are tough times. This fear, this uncertainty, this unrest that we're dealing with this virus, with this change in landscape that we're experiencing. We don't have it figured out as a country. I don't even think as a world, we don't have it figured out. We're still trying to figure it out. We're kind of like making it up as we go. And as I talk to these two different healthcare providers, you can tell that they don't have their stuff together. They really don't know how to really truly advise you. They're telling you things, but nothing is matter of fact. Everything is more like it's up to you kind of thing, but you can't get the test. I was told by one health care organization to basically quarantine myself away from my wife. you know, but I've already been around my wife for the last couple weeks. So if I end up having it, then 9 times out of 10 she has it. It's that whole Idris Elba thing, you know, where he had it and people were giving him flack for his wife being in such close quarters with him, but come to find out she had it as well. Now, in my case, my spiritual beliefs are, nothing's going to come near to my tent, that I'm fine, that I'm not going to catch this thing, but at the same time, you always have to be practical in these situations. You still have to do your part to try to be safe and to try to protect yourself and your family. You have to. So that's what I'm doing. You know, um, I'm not happy about missing work, you know, but it has to be done. But as I've said, people, I'm pretty tired. It's been a long couple of days, so I'm gonna hop off. But I really do need you guys to like and subscribe to the channel. Turn on your notifications. Definitely leave some comments. And in the coming weeks, I am gonna try to add the video chat where you guys can call in and we can live chat. I mean, we can video chat and have a dialogue and really talk about how this thing is affecting your lives. Because I really want to know how it's affecting people, not just my life, but how it's affecting yours, you know. So I want everybody to, be thankful for the people that's in your life. Hug a loved one. Well, let's not hug a loved one. Let's show love to a loved one. Let's still practice the proper social distancing. 6 feet is what's recommended. Call your loved ones. Someone you haven't spoken to in a while. Give them a call. It's time to mend fences. Tomorrow is not promised. It never was, but in these times, it seems like it's these words are more true in this day and age. So it's time to bury the hatchet, so to speak. Let bygones be bygones. Start telling the people next to you that you love them. Because who knows if you'll get a chance to do it again. You know. So with that said, wash your hands. Nasty. And I'm out.